Are you all still alive? Can you all put your hands up? Yes, the sound should have started. Dawn, have you got sound yet? Radial pulse present. That wasn't quite what I was asking, but okay, great. Have you got sound yet, Dawn? I'm going to type you a... You should have an answer there. Hopefully you've got some sound now. Oops. So I'm just showing Rona I can type an answer, because obviously if Dawn can't hear me, then she can't respond.
Yeah.
So it seems that some can hear and others can't. So in terms of technical problems, we'll just see if Dawn gets sound back when she logs back in. Any other questions about this morning? No? Okay, so before lunch break, we were talking about ontology, epistemology, methodology and method, and how absolutely fundamental it is to firstly to really have a handle on what your ontology and epistemology is, and then make it absolutely clear from the outset of your research proposal that what the ontology, epistemology and methodology of your proposed project is going to be. And great, that's wonderful. Dawn, welcome back. So establishing that transparency and that level of clarity right at the beginning is so important. So we'll just carry on talking a little bit about types of research, and we were talking about, we've got as far as going into a little bit more depth about qualitative research. So in terms of qualitative research, we're asking questions like to explore, to examine, to understand, to investigate. So there's no requirement to test anything. And so some of the designs that we might use, we might employ in a qualitative research project might be an ethnographic approach, we might take a phenomenological approach, or we might use a grounded theory approach. And there are many different versions of those three sort of families of research, qualitative research that we might employ. But it is important when you're looking at your methodology section to have a little bit more insight than just saying qualitative. So what is it you're trying to find out? So if you're trying to see how people behave in a certain setting, you might use a particular theoretical stance or perspective. So if we look at those in a little bit of detail, and this is we're just touching on these. So there's an if you decide that you're going to go down the ethnographic or phenomenological approach, there will be a lot more reading and a lot more inquiry that you'll need to do. But an overarching definition of an ethnographic piece is to seek an understanding of human behaviour in the cultural and social context in which it takes place. And so if that is your methodological stance, the methods of data collection that you are likely or most appropriately should use will be observation and maybe an interview. If you want to understand how people behave in a specific setting, you have to watch them. So that observation might be participant observation, non-participant observation, but it's essential that there's an element of observation in that piece of research. So, and you might follow that up with an interview to really seek an in-depth understanding as to why somebody behaves in that particular way. From a phenomenological perspective, it's a great word, that one. I get my 9-year-old daughter to say it, so she talks about phenomenology, which I'm quite impressed about. She's got an excellent definition of phenomenology, and her definition of phenomenology is the study of being phenomenal. That's not quite what it is, but when we're looking at phenomenology, we're looking at somebody's perspective of their experience, and depending on which interpretation of phenomenology you come from, you might talk about the lived experience, but most importantly you're looking at how people perceive their world from their perspective. So if you're doing a piece of phenomenological research, you are most likely to be, or you will have to do, some sort of interview, because you will need to get an in-depth understanding about their perception of their world from their perspective. It's not how you see it, it's not how other people see it, it's about how they see it. And there are different types of phenomenology. There's sort of the traditional German philosophical stance, which looks at hermeneutics, and there's a sort of pragmatic approach which comes from sort of the American theorists, which and they talk very much in depth about the lived experience. But again, if you choose that as your methodological stance, then you'll need to do some further research into it. Grounded theory shares some key traits of ethnography and phenomenology, but one of the key points with grounded theory is it relies on the data to form the theory. So you might use a piece of grounded theory if you're looking at something from a particularly new or different perspective. And so the methodology will be constantly comparative. So we talk about constant comparative analysis and constant comparative methodology. So you would be, you might interview a group of people, and your interview schedule may be adapted and developed according to the findings of your original interview. One of the complexities of developing a grounded theory study is that ethics committees find them rather challenging, because you don't know where it's going to go, and you sort of need to have a bit of a crystal ball when applying for ethics to suggest where you would guide it and take it, which sort of slightly contradicts the principles of grounded theory, but we are bound by ethical regulations, and so that's what we would have to do. Grounded theory can be very interesting and very iterative, but equally it can be quite challenging because you don't have set parameters. So you might say, I would seek to interview 5 participants, reevaluate, analyse, and then seek to interview maybe 3 more, and then 3 more, and 3 more. So it's a constantly evolving process, and what determines your sample size is something called theoretical saturation. So when you're not receiving any new information, that's when you stop, and again, that's where it can be quite challenging to plan a project using grounded theory. Would you like to add anything to those 3 perspectives, Rona?
Other than grounded theory is highly contested really as well because of all of those issues. It's one that if you're going to use it, I would be a little bit more specific as opposed to just saying grounded theory. Maybe that's not too much at this point.
I think if it's something that interests you, there are certain members of staff and there are certain people within the faculty that I would link you up with, either as your primary supervisor or certainly somebody that you need to speak to, because this is a very specific methodological approach. So that's in sort of 10 minutes, qualitative research, which is, there is so much to look at, but it just talks about sort of from a phenomenological or an ethnographic perspective. It really goes back to that earlier statement that I made about really understanding what you want to find out. So So is it understanding behaviour, in which case you are looking at it from an ethnographic approach? Is it from a personal perspective or experience that you're looking at something, in which case you might be taking a phenomenological approach? And so it's really important that you clarify where you're coming from and what exactly you want to find out, so that you can be clear about your theoretical perspective. In terms of quantitative research, you're then asking very, very different questions. So the types of questions you might be asking would be how much, how many, how often, what percentage, what proportion, what risk. So you're asking quite specific questions, and so there's far more definition to your research question or statement. And typically the research design might form an experimental approach, a quasi-experimental approach, or some sort of intervention approach, so intervention evaluation. And commonly, actually, if we were being a bit critical of positivist research, most randomized control trials fall into a quasi-experimental approach, really. We use this term randomized control trial like a sort of badge, which is sometimes very inappropriately worn, but that's possibly my perspective. Rona's laughing at me now. Okay, so if we're looking at an experiment, this is a quantitative process where we're seeking to test something, a concept, and as I said, it's based on a positivist philosophy. So we're looking for empirical data to explain or increase our knowledge about a specific phenomenon. Yeah, I'll come to that in a minute, Polly, what I mean by quasi-experimental. So just looking at experimental to start with. So the key factors of an experimental study are that there's going to be manipulation. Something is going to be introduced, something is going to be done to a group of people or implemented to a group of people, or there is something that we're going to measure. So it might be a drug treatment, it might be a care package, it might be a particular teaching technique. It's something we are doing to a group of people to measure a change. And one of the other key components of an experimental design is that there needs to be a comparison group, and we call that often a control group. And this is a group of participants which is drawn from the same population, so student nurses, if that's what we're inquiring, or a group of patients, or a group of people with the same condition, and they are going to have they are not going to have the intervention. And this is where we talk about they're not proper control groups, because if it was a proper control group, we would have a group that was having the intervention, a group that was having a different intervention, and a group that was having no intervention at all. So for example, if we were evaluating a treatment package, we would give a traditional treatment package, whatever that treatment package was. So if we're talking about some cancer treatment, that might be an operation and, of course, chemotherapy, and that's the traditional treatment. And then what we want to see is if a different treatment works better. So we might give this other group the surgery and a different type of chemotherapy. But to have a proper control group, we should have a group that's having no treatment at all. And hopefully you're all going, well, that would be completely unethical, and you're absolutely right. Because unless we have the control group that's not having anything at all, how can we absolutely categorically say that that treatment works better than that treatment, and it isn't some coincidental anomaly? And the reason we try and establish that it isn't a coincidental anomaly is that by randomizing the groups and blindly allocating them and doing things like double blinding the trial or single blinding the trial, where they don't know what treatment they're getting and the researcher doesn't know what treatment they're getting. So all of these facets to increase the internal validity of the study. And those are some of the key features when you're developing an experimental project. So those of you who were thinking earlier about doing a positivist study and you're trying to design an experiment, think about all of those things. What are you going to do to a group of people that's different from what normally happens, or what treatment or patient outcome, or what is it that you're trying to measure? And what's very important in a positivist study is there needs to be something that you're measuring, because there needs to be some empirical data collected. So we talk about, as I said, randomized control trials. So randomly allocating participants to the experimental or the control group. The experimental group has the treatment or intervention, and then we might introduce, if we're doing a drug trial, for example, we might introduce a placebo. And so people are randomly allocated to different groups. The advantages, we're minimizing bias. We are confounding as many variables as we can possibly manage. We are trying to increase the probability of whatever it is that we're doing to this group being the difference and not anything else at all. So if I was trying to evaluate a treatment package to a group of middle-aged men who suffered from indigestion, I would have to exclude that it was diet or lifestyle or anything, and that it was just the drug that was making the difference. So to do that, I'd have to create a group of people that were all having the same diet, the same amount of stress, the same amount of exercise, the same environment, exactly the same sleep pattern. What else would I have to change? You have to exclude any other variable, and that is actually really difficult in real life, isn't it? So if we had, so going back to that example of the gentleman with indigestion, so if I tried to decide whether ranitidine was better than omeprazole, or the other way around, omeprazole was better than ranitidine, which is a traditional treatment for indigestion, say, and I wanted to prove that omeprazole was better, I'd have to find a group of maybe, how many do you think? 500?
Oh, easily.
Easily. So to get statistical significance, let's say 1,000. I'd have 1,000 men who all weighed the same, were the same age, had the same physical makeup, who had no predisposing conditions, no family history of indigestion. You see, I'm making it very difficult for myself now, aren't I? Because I had to exclude that there was no historical factors that were influencing their indigestion. It's got nothing to do with the drug. And then I would have to start them on the drug treatment all at the same time. So they all these 1,000 men were divided equally amongst the group that were having ranitidine and the group that was having omeprazole. Lansoprazole. No, omeprazole, sorry. Omeprazole. So I've then got 500 having ranitidine and 500 having omeprazole, but then I possibly ought to have another 500, shouldn't I, having nothing at all, because that's my control group. And then I'm going to have some valid, reliable indigestion score that they all understand. And that's a bit of bias, isn't it? Because if I said rate your indigestion from 0 to 5, 0 being no indigestion and 5 being the worst indigestion you've ever had in your life, can you imagine? Most men would score themselves on a 5, won't they? Because they're all such drama queens. I'm not going to see if there's any reaction from the gentlemen in the audience. But we've got to make sure that this is a really valid, reliable tool so I can measure, and I'd have to measure them regularly throughout the course of the project. You see, it's complicated, isn't it? And that's the point I'm trying to make to you, is that to establish a quantitative study, we need to be really structured, really rigid, and really objective.
Yes. And that's quite difficult.
And that is really difficult. And so you will see in quantitative studies, and I'm sure you've all read them, that say this is a randomized control trial. Actually, I would suggest that they're not. And there's some more comments there that you can read through in your own time. I would say that most of them are actually quasi-experiments. And that a quasi-experiment is quasi means false in Latin, and a false experiment is basically doing a treatment evaluation or an intervention evaluation. And that most real life studies that might say they're randomized controlled trials aren't actually, they're quasi-experiments. Because human beings aren't all exactly the same. And so unless you had 1,000 sets of identical twins, but even then, identical twins aren't exactly the same, are they? So it would be very difficult to absolutely establish that you had the same person in every single study. So if you are developing a positivist study, you have got to have very clear inclusion and exclusion criteria, a very clear experiment, a very clear pre and post testing measure. So whether that's as I was saying there, an indigestion score, or I think it was Susie earlier that was talking about evaluating a first placement for student nurses. You're testing it against something. So what is your outcome measure? Is it a satisfaction test? Is it a stress test? Is it what is the test, the valid, reliable test or tool that you're going to use to measure the difference? And there are lots of them out there, and it's absolutely appropriate for you to use something that's been used in the past. And there's huge numbers of valid, reliable tools that you could implement if you were evaluating a specific factor. And depending on what outcome measure you're going to use, then do seek some advice on what tool that's out there already that you can use. You don't need to develop your own. I'm thinking, for example, what's a good reliable tool? Like the Minnesota Post Competencies Testing Scale, which is it measures nursing competencies in a really structured way. There's knowledge evaluation questionnaires that are already tested and have been used in the past. There are quality of life measures that we use a lot with respiratory conditions and cardiac conditions. I know there's a couple of really good ones that are used for patients post-MI about quality of life. So there are tools out there that you could use if you were doing a positivist study. You don't need to design your own. And that can be a way of ensuring that it's a really robust tool. So there's a lot of stuff here that you can have a look at. But one thing I did want to talk about is in terms of qualitative and quantitative research, or positivist and interpretive research, is how you sample. So why do we sample? We can't talk about everybody in the population. So we've got to select a group of people that we're going to ask. And in your research proposal, you'll need to talk in some depth about how you're going to sample. And so depending on which stance you're taking, so interpretive versus positivist, will depend on the sampling technique that you need to employ. And if you're coming at it from a positivist approach, then there needs to be an element of randomization. And so you will randomize your sample from the population by some means, and there are many ways that you can randomize your sample, but most of them are computer generated nowadays for positivist studies. But when you are looking at your sample, you'll need to think about very specific inclusion and exclusion criteria to ensure that you've got an adequately representative sample. So if you wanted to ask student nurses something, first year student nurses, you're not going to be able to ask every single first year student nurse on a programme or across the country. So if you were looking at asking first year student nurses on a Plymouth nursing degree course, you might think, okay, I've got 400 of those. How many of those do I need to make this a robust study? Well, if you're looking at it from a positivist measure, whichever statistical tool that you are using to evaluate and analyse your empirical information will determine how many you need. So your statistical test often tells you roughly how many you need. Whereas if you are coming at it from a qualitative perspective, it's a completely different set of questions. So you talk about randomization in positivist studies. In qualitative studies, we use words like purposive sampling, theoretical sampling. So we're looking at completely different principles of sampling. And this goes back to something I said earlier about once you've got the beginning right, the rest falls into place. So if you tell me that you are doing an ethnographic study where you want to explore why male student nurses behave in a certain way in their first clinical placement, then you are going to purposively sample male student nurses in their first placement. But if you want to find out, I'm trying to turn it into a quantitative project now, what proportion of student nurses I'm trying to turn it into a quantitative project now. So what proportion of student nurses pass their first year OSCE following a set training package? You will want, it won't matter whether they're male or female, you will want a proportion of girls versus boys, which is reflective of the general population, but you of the nursing student population. But you would also want an age ranges, and you would want certain personality types. You would also want to get a distribution of entry criteria. So you wouldn't want to just have white 18-year-old girls who had all got A levels, because that wouldn't tell you what the whole population did. Do you see? Am I making myself clear?
To me you are, but
I'm not sure I'm waffling a little bit, but the point I'm trying to make is that when you've decided what your research question is going to be and your research statement and your methodology is, it then follows on that your method of data collection turns into something, and your sampling strategy is something, and your analysis is something. So the whole thing follows whatever you start with. So if you think about your research and aim as your recipe decision, and you think about your methodology as like your shopping list, if you tell me at the beginning that you are, and then the steps that you need to take is your data collection and the analysis is the way you're going to cook it, and you tell me at the beginning that you want to cook a spaghetti bolognese and you buy chocolate and eggs, you're not going to be able to make a spaghetti bolognese. So what you put in the pan at the end is not going to be a spaghetti bolognese. Does that make sense? Yes. But if you tell me at the beginning you're going to make a chocolate cake, you go out and you buy eggs and sugar and flour and chocolate, and then you put it together in the correct way and you bake it in the oven in the correct way, at the end the result is going to be a chocolate cake. Now, whether it turns out to be a nice, moist Mary Berry's chocolate cake will depend on how well you've done those steps, won't it? Rather than, what I create, which is sort of like a biscuit that's brown, because I'm not very good at baking. But anyway, I'm quite good at writing research proposals. So in terms of sampling, you have to think about your inclusion and your exclusion criteria. And when you're writing up your research proposal, there will need to be a clear section. And we'll talk about that when we talk about the research proposal tomorrow. So, as I said then, You've got inclusion and exclusion criteria and randomization if you're talking about it from a quantitative, positive perspective, and if you're talking about it from a qualitative perspective, you don't use the probability sampling language. You are looking at things like convenience sampling, purposive sampling, and theoretical sampling, and those tend to be the types of sampling that you will use if you are using an interpretive constructionist perspective. So, any questions on that bit? We sort of leapt through qualitative and quantitative research a bit. I don't want you to be put off doing quantitative research because I've made it sound so rigid, because it has, it has an enormous value, and for some of you it might be the obvious choice for what you want to ask and the approach that you want to take. But it's a completely different set of sort of requirements to those of a qualitative study or an interpretive study, where you're going to be seeking to inquire about something quite different. And also do think about the practicalities of what you want to do or what you want to ask. So is it going to be lost my train of thought again. So is it going to be easier for you? Don't make your life more difficult than it has to be. So if you think about some of those principles of the quantitative study and how an intervention, you have to set up an intervention and evaluate it before and after, and that might be something that you're very interested in doing, but those sort of things can be very time consuming, and so sometimes you have to be quite practical in this particular for your dissertation. So in terms of your research proposal, you could be quite idealistic actually. You could write an idealistic proposal, but when it comes to it, you might need to adjust it slightly for the real world. Okay, I'm just looking at a question here. A bit confused. At one slide suggested that using people in a study of a similar age and education, but then spoke about ensuring diversity. Well, again, you see, it depends on what research, what your research question is. So if you wanted to find out what all students thought about something, you would have to get a sample from lots of different groups. You couldn't just, what am I trying to say?
It has to represent the student population.
Has to, yeah. So if I wanted to say that all first year student nurses felt this, that would be a very difficult thing to prove. So what could I say? First year student nurses at Plymouth, I would have to get a sample that was representative of the demographics of our student population. So if I wanted to find out what's first year student nurses, I would have to look at what we have. So if we've got 30% of our student population is 18 to 25, and the other 70% is between 25 and 40, and in my research I only asked two, I had a research sample of 40 and I only asked two older and all the others were younger, then my sample doesn't represent the student population. Does that answer your question? So you have to ensure that your sample is representing the group of people you say you are inquiring about.
Yes.
Yeah?
Yeah, absolutely.
So if I want to find out what young female student nurses think, then I only need to ask young female student nurses, because I'm not seeking to inquire or seeking to test or measure whatever what anybody else thinks. But if I haven't made that statement in my research aim, and I've made a statement that I'm going to ask all student nurses, then I have to make sure that my sample is representative of that whole population. Does that answer your question, Susie? Yeah, okay, great. Any other questions? No. Okay.
So we'll go to Cassidy.
Well, they're all either going, oh no, or
It's easy.
or it's easy peasy. I think, yeah, clarity. So we've talked about ontology and epistemology, and we've talked a little bit about different research methodologies and methods. And when we do the session tomorrow about the research proposal, we'll cover each of the different headings that you'll need to undertake for the proposal and what sort of things I'd expect you to discuss in each of those different sections. But once you've written your introduction, the first thing you need to do is a literature review. And so this next portion of this afternoon, we're going to talk about what a literature review is. Now, for some of you, that's you already know, so some of it might be revision again, but for some of you it might not. And it's just looking at it from a slightly different perspective. So what is a literature review to start with? And why do we bother? Well, it's absolutely essential that at the beginning of a research proposal, we find out what everybody else knows, or well, not everybody else, but what has been written. And it's important that we have an objective and thorough and critical look at the research evidence and the non-research evidence. And this is where I mentioned earlier about when you're setting the scene at the beginning and when you're looking at your introduction, it's really important to have a sort of sociological, social policy, strategic overview. So if you're looking at something, somebody last year looked at the uptake of HPV vaccinations in young women, for example. It's really important to start with what the Department of Health has said and recommended, what the National Institute of Health and Clinical Excellence guidelines might be. So you're starting with a strategic national overview. That might not be appropriate, it might not be applicable in some of your topics, but often there is some sort of a strategic approach that you take in your introduction. And then it's important that we look at the literature that's been written about in that particular subject area. And this is when you will be looking at research and non-research evidence, and to undertake a search of what's been written about the current literature, so that you have an overview. And a good literature review gathers information about a particular subject from many sources, so not just the research evidence, but primarily the research evidence. So a literature review should contain few personal biases. So this is where you're trying to look at what other people have said about a particular subject. Contains a clear search strategy and selection criteria. So you've gone to the literature and you've set up a well-structured search strategy, using whatever databases you like to use, but using the university search strategy format is a useful place to start. So undertaking a primo search, and this is where you're using your search terms, you're searching the literature for a particular subject area to see what's being written. So a good literature review should be well structured, it should have a clear flow, and it is also important that you ensure that any terminology, any specific terminology for your subject area is well defined, either in your introduction or at the beginning of your literature review. So for some of you who are and I'm thinking particularly you, Polly, from a genetics field, if you are going to be looking at it from looking at a subject area that might have some jargon in it that might not be broadly understood, that those definitions are made from the outset. And you know what how OCD I am about referencing, so I'm not even going to mention it again, but I hate it when people can't reference. It's a real pet hate of mine, and there's referencing guidelines online, there's referencing guidelines on the library website, and if you do use EndNote as your database for referencing, then you'll be referencing correctly anyway, but if you don't, then please ensure that you reference correctly.
Okay, what do you use, Harvard?
Yes, yeah, Harvard referencing system. So there are some non-research reasons for undertaking a literature review. You did one for MCH 501, for example, so it can be for an academic assignment, it can be to update your current personal knowledge on practice of a particular topic, it can be to evaluate practice, it can be to develop guidelines, and it might be to develop a work related policy. But you're undertaking this literature review to form the basis of your research proposal. And so there is a clear research focus to yours. And so there are a number of types of literature review. Traditional, or what I call a narrative literature review. And this is where it critiques and summarises a body of literature and draws a conclusion or a statement of what is required about a topic. And it's very useful to gather together a volume of literature to ensure that it's been well summarised and well synthesised. So what's the purpose? Primarily to form that background and a really clear understanding of what is known about a particular subject area. It's always a little bit disturbing when you think you've got this really new and original research idea, and then you do a literature search thinking I'm so new and innovative, and you find out somebody else has already done it and done it like 13 times and well, and you think, right, I wasn't as clever as I thought I was. It highlights the significance of new research. It identifies any gaps or inconsistencies. So just because it's been done before doesn't necessarily mean, certainly at master's level, that you shouldn't repeat it or adapt it or put a slightly new slant on it. And actually, in terms of a master's project, that's actually quite a good idea. Look at what's been written about your particular subject area. And maybe they've looked at, for example, the use of OSCEs in third-year students, but they haven't looked at first years. And so you're going to repeat, adapt a study that's already been done and refocus it on your particular subject area or your particular group of people. And so that's often a really sort of useful way of managing some information.
It's that's the old adage, you don't make it more difficult than you need to. This is you're not going to change the world with this one. This is a practice, almost, if you want to do a PhD. This is what it is. It's a training in research. So that's how you need to approach it, really.
Yeah, and so if there is a study out there that you think, oh wow, that's fantastic, but it's very similar to what I wanted to do, but actually what I wanted to do was looking at it from in a different way, in a different lens, taking a different perspective, then there's nothing wrong with, it's not copying, it's not cheating, it's actually being quite clever about the information that's out there.
Well, you've been able to apply it, if that you understand it, but it's relevant to your perspective. So.
And it, you know, there's no desire in a master's to reinvent the wheel. That's what your doctorate's for.
I can laugh.
Yeah, Rona can laugh because she's got hers. I can't because I'm not. So the review process, and I'm aware that most of you know this. You're selecting a review topic, so you've selected your topic, and all of you have got pretty clear ideas of what your review topic or what your research topic is going to be, and start searching the literature. So you're gathering, you're reading, you're analysing, and you're writing a review. So selecting a topic. When you go to your Primo search, you I can't hear you, Roma, so you're going to have to speak up.
Oh, nothing valuable to say, don't worry.
That's absolutely not true. So you're selecting your review topic. So start off certainly using Primo, because it's a very easy to use, very intuitive search strategy, search tool. Identify your keywords and make sure there's sufficient literature to write a literature review about. And sufficient's a bit of a nebulous term, really. I'm not saying don't go somewhere completely new, but if there's nothing written about a particular research topic, then you might find yourself, it might be a bit difficult to start with nothing. So I would be very wary if you've chosen a topic that's very little or nothing's been written about. So, which I don't think any of you have at the moment. So select an area that holds your interest. I said before, if you find it sort of slightly dull now, you're going to hate it by May. And if it's something that you think you might want to do for your dissertation next year, you're just going to want to kill by Christmas. So if you have no passion about something, somebody said to me, somebody told me I ought to do something on infection control. I thought, well, I'd rather pull my own toenails out than do that study. But, find something that holds your interest and that you have a passion about, because that passion will come through in the research proposal. And equally, when we were talking earlier about ontology and epistemology, if it's where you sit and it's what you're passionate about, that again will come through, and it'll keep you going when it's really, really boring and you would rather clean the fridge. Some of you are going to have very clean fridges. So standard approach, you look backwards through the databases, journals, abstracts, all of those searches. If you find a literature review somebody else has written, it's always a really useful place to start, because their reference list can be an absolute goldmine of sources. Equally, if you find a systematic review, from sort of the Cochrane database or somewhere like that, you have a real resource there. So we refer to that as a networking method, where you're looking at recent papers, commentary, whatever, that they might cite interesting research. If they cite interesting research, then go and find that original piece and read it yourself. Because remember, a literature review is their interpretation, is them looking at that piece of research through their lens. Go back and look at the original, because you might have a completely different opinion of it. So it's a good networking method to find research, but do go back and read the originals. And then manually searching through journals. If there's a particular journal that's focused on your field, for example, one of the students last year was looking at attitudes towards burns. There's whole journals focusing on plastic burns and plastics. So there might be a journal that's specific to your field of interest. So looking at that keyword strategy, and that's actually, keywords are quite, you have to be quite clever using your keywords. And there's some guidance, there's a lot of guidance actually on the library, the LibGuides on the library site about using keywords and how to mix the keywords together, using your and, or, and not, combining search terms and so on. So there's all sorts of search strategies that you can use and you can perfect. And if you did MCH 501 just now, like literally just gone, you will have tried it, and that might have been the first time you used that sort of search strategy. So this time round, it might be a little bit easier, and it is a skill. It's something that you get better at, and I know that from personal experience. I used to find it really quite challenging. You think, oh, there's bound to be loads of research on this particular subject, and you put something in Primo and you come up with nothing that's useful. So it's about playing around with your words and finding effective keywords. And if you're struggling at all, do please email me and I'll put you in touch with our subject librarian, because they are brilliant at helping you with those sort of things. So the databases, we've got all of these databases I've listed here are actually part of the Primo search. So if you do a Primo search using the Plymouth library page, then they're all automatically going through these databases. So there are a combination of things that you're looking at already. So there's just some information there about truncating words. That's another technique that you can use. So I've shown you the example there of using nurse star. So that looks at the root of the word being NURS. So in the articles, they're looking for nursing, nurses, nurse, all of the different connotations of that word. And so again, that's another strategy that you can use in searching the literature. And remember that the search engine is only as intelligent as the person using it. So if you ask it to look for something really specific, like the infection control in surgical wards beginning with the letter P, it will look at it will look for that, all of that, and you might need to separate all of those different words out and then combine them, not get the computer to look for all of that at once. Does that make sense?
Yeah, sometimes you can use the commas, can't you?
The parentheses.
Yes, that's the word. You can use that as a phrase that you want to use.
So if you're looking, for example, you want to look at nursing management, and you type in nursing management, it will look for nursing and management. But if you put it in parentheses, so in inverted commas, it looks for the phrase nursing management, not nursing and management separate. So it's about just perfecting these search strategies. Yeah, well, what you can do is you can, when you articulate your search strategy for the literature review section of your research proposal, you can say undertaken a Primo search which searches these databases, and maybe list some of them. And there's a sort of phrase that people tend to use using Sinal, Medline, PsycInfo and so on. And there's a little phrase that actually they have on Primo that tells you exactly which databases have been searched using Primo. So you can actually use the phrase that's on the library website. So we've talked about this: expanding, excluding, including, inclusion and exclusion criteria for your search strategy. So refining it to date and English language. Don't, again, make your life more difficult and try and get the article in original Japanese, unless, of course, you're fluent in Japanese. But remember that if it was published in a different language, was it translated by the authors themselves, or was it translated by a third party? And if it was translated by a third party, you cannot always be absolutely 100% sure that the meaning has been maintained. You can be hopeful, but not always. So just think about what you're reading, and if you found the right material. So there's some information there about the and, or, and not.
Do they run courses here in the library for that?
They do. There's a whole researching set of study afternoons that they can attend and they can get access to through the library website itself.
Okay.
But equally, on the library website, which as enrolled students they all have full access to, they can go onto the LibGuides, and the LibGuides are little online tutorials, which are, some of them are YouTube clips, some of them are interactive sessions that show them how to do certain things. So there's lots of help there. Equally, they can do a face-to-face. During semester times, 24 hours a day, there's somebody available on a chat line on the library. Wow. So if you go onto the library website and you're struggling to find something, you can click the chat line and there will be somebody there to respond. Yeah. Equally, on the library website, you can click subject recall, which then our specialist subject librarians, who's either Julie Moody or Joe Triplett, will email you back. And then you can make a one-to-one appointment with them if you require one, and go in and see them face-to-face if you don't want to have just an email. So there's loads of fantastic resources in terms of searching and library support. So please do access those support sessions or any of that support if you need it. And if you've any of that, you want some more information about it, then you can email me and I'll put you in touch with all the right people. Because once you've been shown it, it's like, oh yeah, gosh, that's so simple. But until you've been shown it, you don't necessarily know what you don't know. So once you've done the and or nots and you've found your articles, you're looking for some respected peer-reviewed journals, categorise your articles, either reviews, descriptive research, and so on. You might want to try and find pieces of research that use your particular methodology as well as your subject area. So if you've got lots of subject area research, you might want to look at some other, and you've decided to take an ethnographic approach, for example, you might want to search some ethnographic studies and see if there's other methodological studies that help you. And then it's about reading it. So I just answered this question. For 501, we had stated themes, yes. One theme in which the researcher does include all this. So whereas before, Elizabeth, I was asking you to actually review the literature and undertake a thematic analysis of the literature. You've sort of done, if you've done 501, you've sort of done step 1.5 for this next bit. At the end of your narrative review, you wrote an overview and a synthesis section, and that's what it's the overview and synthesis section I'm expecting in this particular assignment. So not lifted, because you've got to apply it, but it will be a growth of what you did in 501. That thematic analysis isn't necessary for this assignment, because all I want for this assignment is an overview. But if you're doing exactly the same topic as you chose for 501, then some of the work has already, if not most of the work, has already been done. But some of your colleagues haven't done the 501 module, so they have to sort of start from scratch. Yes, I do want a brief search strategy, i.e. keywords and databases, but in a very short sentence and a half. I don't want a detailed search strategy. If you want to put that information, that's what you can add to the appendix. You've got a limited space, so think about what I need to know for the research proposal. Any other questions? Any other questions? No? I don't know how to answer. I will. I'm giving. Sorry, I'm just trying to fiddle with my questions. I can't. Is there a bit more to that question coming, Michelle? In terms of your question, Yenny, I think I will address that separately if that's all right with you, because I think there's a couple of issues there that we could discuss in terms of your literature review. Are we giving it? Yes, we are. Yeah, that's exactly what I'm asking. I'm for this assignment, a general literature review. If you had thousands of words, you would do, and you were doing another narrative review, you'd do what you did last time, where you're doing a thematic analysis. But on this one, I want simply an overview. So you'll have had to have undertaken the critique and the synthesis first to give me the overview. So those of you who have just written a literature review have done step 1, and this is step 2. Does that?
Yes, because they've done the research, haven't they?
Some of them have, but you might be changing the focus slightly. Remember, you've got a research question, because at the end of your narrative review, if you've just done 501, you had a research question. So remember, you've got to refocus that, because if your research question is going to stay the same, then fine. If it's going to adapt, you might need to reflect that in the literature review that's come before.
Yes, absolutely. And I think that's something when they go on to the dissertation that they have to be aware of, that as the research changes, as it always does, you always have to go back and refocus that literature review. It's never a completed work.
Yeah, a literature review is very much a sort of evolving thing.
Absolutely. Such a wildflowers.
So, where did I get to? Does that help? Does that answer your questions? Hopefully, yes. Any more questions? Great. Okay, so that's a traditional or a narrative review, but then also we've got a systematic review, and you do have the choice. You can do a systematic review for your dissertation. You don't have to do a piece of primary research. So if you choose to do a systematic review, you still have to do a literature review first, because what you've got to do is got to see what's been written about this particular subject area, and then a systematic review asks a different research question, or a slightly adapted research question, or interprets the data in a different way, and asks a new research question.
It does. To plug a gap that's been identified by the literature review again.
Yeah. So you've done the overview of the literature, and you've identified that this particular hole exists, but you can answer that hole by re-evaluating data that already exists in the published material. And it's a different research technique, but you still need to outline the same sort of proposal for a systematic review. So you do have the choice. You can do that for your dissertation if you want to, and I know there are certainly one, if not two, people who are thinking of that approach for next year. So then we've got to analyse the data, and you've got to ask questions of it. So review it, question it, read it, summarise it, all of these classic steps that we talked about. And I'm sure you've done this in the past when you've read any material. So classify the article by type and source, undertake a sort of systematic or critical review of the article. You can use critical appraisal tools that are published and published widely to appraise the literature if you wish. I know there are many research textbooks out there, and hopefully all of you have found a research textbook that suits you and you find slightly easier to read. And in every single one of those research textbooks, there'll be some sort of critical review framework, CASP tools, something that you can use to evaluate the literature with. And so it's important that you find one that suits. I'm not going to say you have to use this one or that one and be that prescriptive, because I think it's a matter of some personal choice. And again, it goes back to ontology and epistemology, doesn't it? So there are certain appraisal tools like Kemet et al. That we've used in the past, in the previous modules, that are very quantitative. They're asking you to score things and measure things, and they give you a very specific evaluation at the end. You know, does the research meet these criteria, tick boxes, and so on. There are more narrative evaluation tools like the one in the Parahu textbook that's on your reading list, or the Pollitt and Beck textbook, which are much more interpretive. So they're asking specific questions for you to ask about the research, and so that allows you to be slightly more interpretive. So it depends what suits you. Equally, it depends on what the body of knowledge is coming up with. If all the research that you are searching or coming up with in your particular subject area is positivist, then using a scoring technique like Kemet's might be useful. Whereas if it's a qualitative research in nature, interpretive research, then using that kind of scoring technique isn't always helpful. Do you have anything to add?
No, not on that one.
Okay, so you preview, you ask some questions of it, read it, and I've mentioned the CASP tool there. How you organise your data and how you organise your literature review is a matter of personal preference. You know, some people like to colour code things, some people have piles of stuff all over their dining room tables. You know, it's completely your decision. And finding a manageable way to manage the data is really useful, really important, especially if you're going to take this subject onto your dissertation. Having some practical organisation is really important, whether it's files that are all different colours, or whether you're using EndNote and you're storing everything on the computer as a PDF. Make sure you've backed everything up, because there's nothing more heartbreaking than losing all your research. But it's just find your personal preference. Having done your doctorate, Raina, is there any particular advice that you would give on that?
I'm probably not the one to ask, because you would kill me. I was one of those with piles of subject matter across my entire office at home for 3.5 years. So it's the only. I'm not the tidiest of workers like that, as in just I tidy up at the end.
Yeah.
But it's what works for you. Some people have big A3 sheets of paper on the wall with ideas on. People write on windows, you know, in paint, and there's a whole array of things I've seen, but it's what works for you.
Yeah, I've got a bit of OCD, so.
But yeah, I mean, I'm just one of those. It's piles of things, and I just happen to remember where things are. Hopefully.
Okay, so yeah, I'll let you decide your way through that one yourselves. One of the final stages when you're analysing the literature is to appraise each article, sort of give an overarching appraisal, and that's really important. And just what did you think about it? What were your key thoughts? What were its strengths and weaknesses? And what did it add to your knowledge? And so how does it stand up as a piece of work on its own? And then you can really put it together when you're writing your review. So it shouldn't, this is quite a short section for your research proposal. So don't spend too much time on it in terms of structure. There needs to just be a section that you've given me an overview. But if you were writing a longer review, obviously that it would have an introduction, a body, and a conclusion. You are writing an introduction, so you should therefore be giving me the key terms in your introduction. Then you go into justifying your final selection of what articles you've looked at. So comment on the depth and breadth of the literature that you've sourced. With this will give the marker and the person reading your review a clear indication of where you've looked, what you've looked at, and why you decided to look at those particular things. And we might comment on that and say that it needs to be broader, or it should have been narrower, or you should have gone into more depth in this particular section. And then you can take that advice maybe and build it for your dissertation. The research proposal is a bit of a snapshot literature review. Obviously, it'll need far more expansion when it comes to your writing up.
Can I add something there? It was just to say that if you find some literature which might be quite dominant, but you choose not to use it, don't be afraid to do that, but acknowledge why you're doing that. So as long as you actually acknowledge or evidence why you do something, then that's fine.
Yeah, I would agree, because there's some pieces, certainly in certain fields, where there's been a predominant piece of research, and you might be not wanting to look at that for all sorts of reasons. I'm thinking, for example, in critical care, there's one predominant piece of research about proning patients with respiratory.
Yes.
And it's been dominant for years, but it isn't a perfect piece of research. It has some flaws, and so you might choose to look at what else has been written rather than this rather dominant piece that's sort of blinkered some people's perception of the technique of proning patients. Anyway, that's a particular focus. So as long as you identify why you've excluded a piece of literature, then it's absolutely fine to do so. So using a critical approach, you're evaluating the studies, and then you may develop more than one theme. Elizabeth asked earlier if we were just doing one theme for this. You're giving an overall appraisal for your research proposal, but it doesn't mean that you haven't undertaken the thematic approach beforehand. I don't think you can make a conclusion of a body of literature until you've done that. It's a process.
And you may identify more than one thing, you usually will, but you may want to focus on one thing. So as long as you acknowledge that there's more, that this is where your interest or research lies, then that's fine as well. It's all about evidencing and supporting why you are or not doing something.
Yeah. So it's like giving us an audit trail as to your decision-making process. So this is the body of knowledge that I've found. These themes have come out of the research, but it's this theme particularly that's going to be the focus of my research, and it's going to be the focus of my literature review, and so on. So that there's a sort of inclusion and exclusion criteria. And as long as that conversation is evidenced and clearly articulated, then that's that wouldn't be criticised. If you are choosing to go down a particular methodological route, then I would expect there to be a dominant methodological stance in your research proposal. In your literature review of your research proposal. So if you're going to, if you're going to ask a qualitative question at the end, and you're going to go down that sort of an ethnographic route, for example, but there's been nothing written about it, that might be something that you'd want to highlight. But I would expect there to have been some background to that in the literature review.
Yes,
wouldn't you?
I agree. Absolutely. You may find, I would be very surprised if you don't find something on most subjects. I mean, there is knowledge that we don't know, we're not aware of, which is fair enough. But for something of this level, yes, there's bound to be something. I've lost my train of thought now. What were we saying?
I don't know, we might as well just have a conversation because I'm not sure that any of them are alive.
No. Anyway, I'll come back to it when I can remember.
So if you are going to do a quasi-experiment, then look at some quasi-experimental research and ensure that you have done. If you are going to talk about an ethnographic, if you're proposing to do an ethnographic study, then talk about ethnographic research that's been done previously.
That's what I was going to say. That was it.
But I said it.
You did.
I'm losing my voice. I think I'm going all squeaky. I might have to suck Strepsils tonight, otherwise I'm going to be even more squeaky tomorrow. So, the literature review gives an overarching evaluation of the strengths and the weaknesses of the body of knowledge. So prior to you writing that, you've got to have evaluated each. You've got to look at similarities and differences. You've got to explain and justify inconsistencies, discuss why inconsistencies are there, and as I stated earlier, identify, most importantly, the gap that the review articulates. So what is it that's going to be new and special about your study? And that might be slightly contradictory to what I said, because it's okay to repeat, but there's got to be a new slant to it, a new interpretation. Maybe it's a study that was done 20 years ago and you want to repeat it because socially and textually it's a different question now or something. There's some difference to it. Or this is a study that's been done in a city and now you want to do it in a rural environment. Or
even if it is a repeat of something you've done before that is a qualitative interpretive piece, it will be different because of your subjectivity on the analysis.
Mm-hmm.
So your perspective and your take on it will be different to the other person. So it will always, those types of research pieces will always be different.
And so if you are going to use something that's been done before as a basis, then just articulate how you're going to make it yours and make it individual. Might it be from a different healthcare system? Absolutely, yes.
Absolutely.
There's been so much, other research done elsewhere. America, Australia, New Zealand, Canada. I'm talking about countries that are English speaking, simply because the research might be easier to access. But there's also been a wealth of research done in Australia, for example, about the HPV vaccination for young girls, because they've been implementing it for, I think it's 22 years now. We've only made it a statutory requirement in the last 10. So the research out of Australia on HPV vaccination is massive, whereas we haven't done very much research here. So if you're looking at something that's been done abroad for a long time, or something that we've adopted in this country recently that's been done elsewhere, or a particular perspective on treatment that is from abroad that you want to see if it will work in the UK, then yes, absolutely. Could I replace? I'm not quite sure I understand, Laren, in what way? You've said, could you replace a learning disability? So would that be replace a piece of research has been done on patients with Down syndrome, for example, and you want to repeat it looking for people with depression? Is that right? Oh, okay, yes, yeah, no. Your literature review did focus on patients who had learning disabilities, didn't it? So yes, it would be looking at it from it, but what you might need to do in terms of mental health is define exactly what you meant and what your inclusion criteria for patients with mental health conditions, because that could be quite broad, couldn't it? So it would just be about focus and definitions, really. Does that answer your question? Great. Okay, so where have we got to? So when you're writing your review, you're trying to be objective. Avoid using lots of quotes. One is fine, two is okay. If you constantly using quotes through your literature review, it can detract from your understanding, because writing somebody else's understanding is one thing, but I want your interpretation of the research, not what was actually said. And
sorry, I was going to add something there, because
okay.
Quotes are one of the things that I get annoyed with at times. Is, quotes are fine, but when you do use them, always explain what is meant or your take on it, or critique it afterwards. Don't just put it in there. There has to be a reason why you've used it, and you need to show us that reason.
Yeah, because I would say using a quote is a very level 5-6 way of presenting material. And the difference in level 7 is, so at master's level, is saying, okay, this is what somebody said, but this is how it applies to my field, and this applies to me, and this is my interpretation, and this is my evaluation of that comment. So that's sort of really anchoring what you're reading and what you've quoted back into your understanding and your application. So it isn't enough to just to give us a quote. And write your findings succinctly, because you are very limited. This is, you might think to yourself, oh, 3,000 words is loads, but it isn't loads. You've got lots to do. And so I would say that the first section needs to be between, less than 1,000 words.
Yes.
In fact, I'd say 750 words for the first two sections is quite adequate, and that's actually 2 pages.
Yeah, absolutely.
Because the bulk of the marks and the bulk of the allocation of the marks is on the next bit, or in the next 3 bits.
And we've got 20 for the literature review.
Yeah, so 25% on these 2 bits.
This issue.
Yeah. So that bit in the middle, which has got 55% of the marks, is the bulk of the words and the bulk of the marks. And although you've got 25 marks in the first 2 sections, it's not 25%. Well, 750 is about 25%, isn't it?
Yeah, it is.
Of the words.
It is.
So you've got to be really succinct. And your conclusion of your review is what you're articulating in your so the gaps of the literature sentence, or a sort of concluding statement to identify the gap, which you then turn that gap into your aim and objective. So the gap of the literature is this, which is why I'm now asking, I want to explore this, or I want to evaluate this, or you're not going to use I because you're not writing in the first person, but the research will. And then research proposal, you are proposing it, so you're always talking about what you would do in advance. Well, the joining together and the synthesis and the overall strengths and the weaknesses is what you've got to do before you can write your concluding statement, your concluding overview. What you're presenting in the research proposal is the overview. So this is what the overall strengths and weaknesses of the literature that have been found are, not each individual theme. So you might articulate that these themes have come out of the literature review. The overall strengths and weaknesses of these themes are these, and this is where the whole exists. So it's very much an overview and a synthesis of the body of knowledge that you've reviewed, not the thematic analysis, which is what you did last time. I don't want that this time, because that's not the focus of this assignment. But I still need this assignment to have an anchor in the literature. Does that make sense? Yeah, the two examples that are online that I've yes and no. The two examples that I've cited online have quite, good literature review sections, and I think that'll give you a clear indication of what I'm after in terms of this. So have a look at those, and there's a qualitative one and a quantitative one that give an overview of the literature to begin with. So that might be helpful. I'm not sure. Is it what we have just covered indicates? I'm not sure I understand that question actually.
See from there. Not to be choice.
Makes sense. However, what we have just covered indicates analysis per paper. I don't understand. Sorry, Lisa, I might be being a bit thick, but I don't understand the question.
Yes, you analyse each paper, but you don't write about each paper individually. You collect that information and then write as a generalisation, as opposed to. So yes, you are going to analyse each paper, but not write about it. It's how you get to the overview, is what we've discussed, isn't it?
Yeah.
It's not the actual. We're not saying that you're going to write that deeper one this time. That's for next year. But in order to even write an overview, you have to have a good understanding of the literature to be able to draw out those themes. So that's what we're saying, is that you still need to do that work. Correct me if I'm wrong, but we actually don't want to see all of it. We want to see the end result of it.
Yeah.
Is that right?
Yeah. So there will. It might seem like an awful lot of work, but unfortunately, it's necessary for you to write that first 750 words. You have got to have read the literature you've chosen to synthesise, critique the literature, undertake some sort of an overview analysis of the literature, and then write it up in a succinct way. And it's only step 4, writing it up in the succinct way, that I actually want to see for this assignment. The 3 stages that have gone before, which is reading it, critiquing it individually, and undertaking an analysis of it as a body of knowledge, is your preparatory work. That sounds a bit mean, but that's sort of the process that you need to go through before you can make that concluding statement, that overview of the literature itself.
I would say it's similar to the process of ethics, in that you can do 6 months of work behind the scenes to get your ethics approval, but you have one line actually in your thesis that says, I have got ethics approval. And we all know what you've been through. So it's the same thing. And at master's level, that's what we expect, is you to do an awful lot of reading, but we actually only want to see the best bit, really, rather than the whole thing.
And I know what you're saying. Yes, it is very challenging in 750 words.
Yes.
And I won't really apologise for that.
That's what we're trying to get you to do.
Yeah,
That's
I'm actually expecting you to have done 3,000 words worth of reading and write it very, very succinctly in a very small section. And that's just because I'm not very nice. But when hopefully, if you read the ones that are online, have a look at those and see and then we can talk more on Tuesday about what specifically I might expect of you. So, we can revisit this in a little bit more detail on Tuesday when we're face to face, and it might be a little bit clearer. And I'll bring some other research proposals with me when I come, so that you can have a little bit of a look. Okay. Right. So there's some and then you're making the conclusion of this particular section, and that's what your review should offer a rationale for conducting the next bit, the research. So it's your rationale for how you have arrived at your aim and objective, or your aim and objectives. And so that's where you're taking this particular review into your research proposal. And then we're going to go through each of those particular sections tomorrow when we talk about writing your research proposal. Okay, there's some references at the end there. There's some references as well on the Talis Aspire reading list. And there's a couple of very good books on doing literature reviews, which you can source out of the library. The Aveyard book, which is Aveyard, Aveyard book, is actually quite good on writing literature reviews if you want some further information. So, any questions on the literature review? Okay. Well, it's been quite a sorry. It's been quite a. I've been doing an awful lot of talking today, so there's been quite a lot to think about, quite a lot covered. Hopefully, you're not feeling like jumping off a cliff. But have you got any questions, any comments, any things that you'd like me to do in the next bit? Obviously, we've got a session booked tomorrow for our webinar, and you've got the links for that. Yes, I suppose there are advantages and disadvantages, aren't there? Because for MCH 501, we met every fortnight for a couple of hours over a long period of time, and this time we're meeting every day for 4 days, and it's all bunched in together. So you've got an awful lot to think about, and hopefully your head isn't exploding at this particular moment. But there is quite a lot to think about, and there is quite a lot to absorb. I do understand that. And have a little relook at some of the material that we've covered today, if you can, this evening, but possibly stop now and have a nice cup of tea. And obviously, if you think of any burning questions over the next sort of period, and you either want to ring me, I'll be in the office until about 4:30. Otherwise, we'll meet again tomorrow at 11 o'clock, and we can cover any questions at the beginning of the session. You step back from the cliff. That's great. That's fantastic. I never like to think of never like to think of people leaping over cliffs at the end of my sessions. So yeah, it might be quite nice to sort of, have a think, have a sit and think this evening, if you can, about where you're going to take this. The clarity of aims and objectives is really, really important, and we'll be working on that over the next few days. We'll certainly be working on that quite strongly on Tuesday, whether we're physically together or remotely together. And great. And yes, if you're, we'll be webinaring. I'm not sure that is a verb, but I'm going to use it as a verb, from 11, and I will upload these recordings as soon as they're all converted, or whatever they do to them, so that you can listen to them again if you need to. So any questions before I go? No? Okay, well, thank you very much for your attention, and I will see you all tomorrow if you can join me. If not, as always, it will be recorded and uploaded later. So hopefully see you tomorrow. If not, let me know and send me an email. Okay, bye then.
Bye.